Hi, my name is Delilah, and today I'll be demonstrating proper oral hygiene techniques using my Typodont. I will be working with the fictional patient, Regina, a 32-year-old woman who has mild gingivitis, mild crowding in her lower front teeth, and occasional bad breath. I'll go over the best brushing methods, interproximal cleaning, denture vices, and mouth rinses for her specific needs. Let's get started. For Regina, I'm recommending 2 different brushing techniques based on her dental concerns. Modified Bass for gingivitis. The modified Bass method is ideal for patients with gingivitis because it helps remove plaque along the gum line and gently massages the gums. To do this, hold your toothbrush at a 45-degree angle with the bristles slightly under the gum line. Use small circular motions, then sweep the bristles away from the gum line. This method helps remove plaque while also stimulating the gums to reduce inflammation. For Regina's mild crowding, the modified Stillman method will help. Instead of just circular motions, we use a gentle vibrating motions, then sweep the brush towards the chewing surface. This method is great for cleaning tight spaces and stimulating the gums. Lastly, don't forget the chewing surfaces. Use short back and forth scrubbing motions to clean the grooves of the teeth where food can get stuck. Tongue brushing. A lot of bacteria sits on the tongue, contributing to bad breath. Regina struggles with halitosis, so I'm recommending tongue brushing as part of her routine. To do this, gently scrape or brush your tongue from back to front. Do this a few times and rinse your mouth after. So we're going to pretend my patient has a tongue. For Regina's gingivitis, I recommend an antimicrobial toothpaste like Colgate Total or Crest Gum Detoxify. These contain stannous fluoride or triglycerin, which help reduce plaque and inflammation. Fluoride also straightens the enamel to prevent cavities. Now let's talk about cleaning between the teeth. Since Regina has mild crowding in her lower front teeth, she needs a good technique to remove plaque where her toothbrush can't reach. I recommend wax floss since it slides more easily between tight contacts. The key is to form a C shape around each tooth and gently glide up and down under the gum line. Another option for wider grafts would be soft picks, which are flexible rubber-tipped tools that can comfortably clean between teeth without causing damage to the gums. They're a great option for patients with larger spaces between their teeth. Water flosser. For patients with larger spaces, a water flosser could be a great tool. It uses a stream of pulsating water to clean between the teeth and along the gum line, making it a non-invasive and effective alternative to traditional flossing. To help with Regina's bad breath, I am recommending an antimicrobial mouth rinse like Listerine or Smart Mouth. These contain ingredients like essential oils that kill odor-causing bacteria. She should swish for 30 seconds twice a day for the best results. In patient education, we use the tell, show, do method to ensure the patient fully understands proper oral hygiene techniques. This method helps reinforce learning by combining verbal instructions, demonstration, and hands-on practice. First, I tell the patient what they need to do. For example, I would explain how to hold the toothbrush at a 45-degree angle using the modified Bass technique for gum health and why it's important. Next, I show them exactly how it's done. I demonstrate the small circular motions along the gum line, how to properly floss using the C-shaped method, and how to use a tongue scraper for fresher breath. Finally, I let the patient do it themselves while I guide them. They hold the mirror and practice the techniques while I provide feedback. This hands-on practice helps them build confidence and ensure they can maintain proper oral hygiene at home. Using the tell, show, do method makes oral hygiene instruction more effective, ensuring patients to not only hear and see what to do, but also get the chance to practice it with guidance. Motivational interviewing is a way to help patients feel more confident about improving their oral health. Instead of just telling them what to do, I encourage them to think about their habits and find solutions that work for them. I start by asking questions that get the patient talking, like, how do you feel about your brushing routine? What makes flossing hard for you? This helps me understand their challenges and what they need help with. I encourage my patient by pointing out what they're doing well. I might say, you're already brushing twice a day. That's a great habit. I can see you're trying with the flossing technique. Keep it up. This helps them stay motivated. If they say flossing is too hard, it's because their teeth are close together. I suggest tight spaces can be tricky. Wax floss or a floss pick might be easier for you. This way, they get a solution that fits their needs. Instead of overwhelming them, I ask, what's one small change you feel comfortable making? Even a small change, like flossing a few times a week, can help them improve over time. Motivational interviewing makes patients feel supported and in control, so they're more likely to stick with good oral habits and see real improvements. And that wraps up my oral hygiene demonstration. Today, I covered proper brushing techniques, flossing, tongue cleaning, denture file selection, mouth rinses, and how to educate patients using the tell, show, do method and motivational interviewing. These strategies help patients take better care of their oral health and stay consistent with their routine. Thanks for watching.